So really, with DEFINITY, an appropriate, timely, and cost-saving and accurate diagnosis was made, saving downstream testing and sparing this patient from unnecessary radiation exposure and an invasive test. Really, DEFINITY clearly had an impact on the patient management in this case.
It is not good enough to say, I think. You must say, I know. You need to see every single myocardial segment. You need to see every single segment well, and you need to have a high level of reader confidence.
Anytime there's concern, or there's a territory that is not well visualized, I instruct my sonographers to use contrast. If you have to think about it twice, then the answer is you need to use DEFINITY.
And certainly if you don't see two or more segments of the endocardial border, then again, as we saw earlier, all the societies advocate the use of contrast echocardiography in that setting.
And efficient use of DEFINITY leads to optimization of our echoes, improved patient outcomes, and actually improves the cost effectiveness of our labs.
The use of contrast also helps us to get a more accurate assessment of volume compared to MRI, for example. We almost always underestimate volumes when we use unenhanced studies.
Good enough is not good enough anymore when it comes to patient management, when it comes to ICEL criteria. They look to make sure that you have exhausted all resources possible to view the best images possible and identify the left ventricular endocardium. If you use DEFINITY, you will be surprised more often than not.
So that's a good message for our ultrasonographers.
Using DEFINITY, we could improve the diagnostic accuracy and absolutely impact our change in management. We know that DEFINITY improves quality, improves diagnostic outcomes, impacts the diagnosis, alters the medical management, decreases diagnostic procedures, and in doing so, reduces resource utilization and per patient expense. Let me rephrase that. The use of DEFINITY reduces resource utilization and per patient expense. Our administrators seem to think one-to-one.
You have patients who you're short on time. You don't have days or weeks to figure out what's going on with them. Sometimes you only have minutes or hours. You need rapid diagnosis and you need an accurate diagnosis so that you're not subjecting them to a lot of aggressive, invasive treatments that they don't actually need. I think we're going to show through today's webinar that the addition of DEFINITY along with good echo technique, you're going to enhance your ability to do that, provide more timely diagnoses, more timely interventions, and avoid things that would potentially be dangerous for people by having a faster, more accurate diagnosis.
We have a duty to get an accurate diagnosis for our patients and as fast as we can, because that's how we can decrease the length of stay, be more cost effective, and have a much better outcome for our patients. And we should understand that when we are going to image a patient, we want an answer. And if you don't have an answer, think about DEFINITY.
Not all ultrasound enhancing agents are alike. DEFINITY has a unique characteristic that contribute to the consistency, image persistency, and performance that we achieve with DEFINITY.
And one of the things many people forget is that wall thickening is every bit a part of looking at wall motion abnormalities. In order to determine accurate wall thickening, it's vital to have good endocardial and epicardial definition. In this instance, that's clear proof that we need to use DEFINITY in order to have good endocardial definition so that we can see subtle changes such as wall thickening.
Let's review the important safety information for DEFINITY. DEFINITY Vial 4 Perflutrin Lipid Microsphere Injectable Suspension. Indications. Activated DEFINITY Perflutrin Lipid Microsphere Injectable Suspension is indicated for use in patients with suboptimal echocardiograms to opacify the left ventricular chamber and to improve the delineation of the left ventricular endocardial border. Contraindications. Do not administer DEFINITY to patients with known or suspected hypersensitivity to perflutrin lipid microsphere or its components, such as polyethylene glycol, PEG. Important safety information. Warning. Serious cardiopulmonary reactions, including fatalities, have occurred uncommonly during or following perflutrin-containing microsphere administration. See Warnings and Precautions 5.1. Most serious reactions occur within 30 minutes of administration. Assess all patients for the presence of any condition that precludes DEFINITY administration. See contraindications. 4. Always have resuscitation equipment and trained personnel readily available. In post-marketing use, rare but serious cardiopulmonary or hypersensitivity reactions have been reported during or shortly following perflutrin and PEG-containing microsphere administration. See Adverse Reactions 6. The risk for these reactions may be increased among patients with unstable cardiopulmonary conditions and/or with pre-existing PEG hypersensitivity. See Adverse Reactions 6.2. It is not always possible to reliably establish a causal relationship to drug exposure due to the presence of underlying conditions. Please see full prescribing information, including boxed warning, regarding serious cardiopulmonary reactions. Full prescribing information is available at DefinityImaging.com from a Lantheus sales representative or by contacting Lantheus customer service at 1-800-299-3431.